Welcome everyone. I am excited to be here to talk about every Thursday. I come on and talk about family trauma solutions. And this one, as it's coming across your screen and even more detail, why should we even talk about nutrition trauma? And also, how do we even integrate it into, you know, working with trauma treatment? Now, this will be for families, but you can also you'll see how you can use this self-assessment, whether you're working with an individual, a couple, a group, etc. So I'm excited about this because it really dovetails off of next week's talk too, when I'm with you guys on Thursday, where I'm going to talk about the self-assessment and why trauma and family systems work. And then it'll dovetail nicely to next week, where we talk about something that is called the Family Systems Trauma Nutritional Playbook. So I'll also put in the screen, or this will be posted as a recording. You will also get a chance to download this free dietary guideline, and you can actually see a example from the case study I'm going to do today of the FST, or Family Systems Trauma Nutritional Playbook. So I'll talk more about that at the end, but this is a free resource for you to use immediately with your clients. So if you have not met me before, I'm part of this community. I love being part of this community. I love working with Dan and B. And I've just gotten so much of just seeing how we interact. And I just happen to be somebody who loves toolboxes. In my book that I wrote, it's just straight out step-by-step tools. And really, if you want to become an expert at family trauma, you're at the right place, because this is my mission statement. I want to train every professional and paraprofessional to become an expert at family trauma, because what I saw as a huge gap is we have trauma informed practices for the individual, but not so much step-by-step tools for the whole traumatized family. And so the book, if you want to go deeper, is Treating the Traumatized Child. You can always go to Amazon for that. And the model that we're going to be talking from is the Family Systems Trauma Model, a step-by-step family systems approach. And my website is familytrauma.com. Within this model, there are 12 techniques, and I'm going to be highlighting today number 8, nutrition and trauma. Why is this so important? How is this going to really help our clients who are traumatized? It's a very holistic approach to trauma treatment. So I'm going to give you a Surgeon General warning or cautionary note. I believe that we should never, be expected to be nutritionists. We should not practice outside of our areas of training or licensure. And I don't think we talk about that enough in our field. That being said, I also think we can have a really impact to connect a person to a nutritionist by the work of jump-starting the process. I think sometimes we don't give ourselves enough credit. My background is social work. So one of the roles that I have is a broker, where I try to connect people to services, like I'm the bridge. And I loved this technique because I got an opportunity to get people excited about nutrition. And in the old days, I'd say, here's a piece of paper with a number on it, call this nutritionist, and they would never call. And I would ask clients later, so why didn't you call? And they said, you never really bridged it for me. You never told me what's in it for us, why we should do it. We never had any initial victories in this area. And I thought that is really wise. And the other thing is that you should, if you like this approach, connect with your local nutritionists, have coffee with them, get to know them, explain that this is a family systems trauma approach and that we're breaking down silos. Because when I send somebody to a nutritionist, I don't want the nutritionist to say, I've never heard of this guy. I want the nutritionist to say, I understand that Scott started off with a nutritional playbook. I've seen his playbooks. I know where we're going. I'm going to be in touch with him with signed releases. And so we work together in synchronicity. So one question I'm going to pose to the community is, do you think these roles are important for us? That our role is not just direct practitioner, but we're also jump starting the process, that we contend for initial victories, and we're also a broker. So as you watch this, on demand, I'd love for you to comment on this, because I'm going to go back into, this recording. And the first question I have for you is it appropriate for us to have these roles as broker, especially with a strategy like nutrition? Yes, no, and why? I think it is. And here's why: because I just think without us being a bridge, it will never happen. So, where this actual technique comes is chapter 7 in the book, step 3, neuroplasticity and proper nutrition. Many of you have heard of that technical term. It's called neurons that wire together, fire together. And in the old days, not so long ago, we thought that once a brain was traumatized, it was stuck. We also once thought that if you smoked, that your lungs were irreparably damaged. But we know with science that the body is an incredible organism, machine, that it can, given the chance, it can heal itself. And when I, saw people who smoked, years later, we could see their lungs return pink again. The same way, a lot of our clients, in fact, most of them, have no idea that neuroplasticity, even the word means pliable, changeable. And many of the book, The Body Keeps a Score. So what we have to do is educate people on this, because if we just say, go see a nutritionist, they're going to be thinking, why? What's in it for me? So our role is to slowly say, here's why trauma and nutrition is important for you, because of the science, the research that shows that literally, if we put the right nutrition in our bodies, it can actually help the brain rewire itself. It's like fuel. And what is so rewarding, and I'm about to show you, is a very small little script that I went over a little bit last week. But people are like, wow, I didn't know that this could happen. Because what will happen a lot of times is parents will say, just fix my kid. And so they'll go right for psychotropic medication. They're like, I want you to refer us to a nurse practitioner, a psychiatrist, or we've already seen our family doctor and we want meds. So what happens is the families, out of ignorance, don't know that they can try the nutritional brain change first, and they go for the medicated brain change. And the problem with that is that psychotropic medications will stop the symptoms quickly. And so the family gets into a false hope and be like, yeah, it was a chemical imbalance, where really, as soon as the medication wears off, the body returns back to the symptoms of hyperactivity, depression, etc. But with the nutritional brain change, it's more permanent because you're getting to the root. So as we talk about this, let's talk about, what do we do with this information, because knowledge is extremely empowering. Okay, so as we go on, if you guys watch this and go, man, I really like this, I like the teaching, the style Scott does, I just like the information, I like the tools for Toolbox. Every month I do an hour webinar where the big difference is it's more interactional. I show a case study, and I have the time to really unpack this. So what you're getting kind of like in these short little Facebook Lives with our community is just kind of like a preview of upcoming attractions, kind of a movie trailer. So you're getting more of the why, and this gets you more of the how. So at the end of watching this, You can go on live, which I recommend because there's a lot of interaction, or if you can't come live, you'll get it on demand. So that's July 21st, 12 to 1 Eastern time. Okay. So the first thing we got to start is acknowledge that nutrition and trauma right now and mental health are on different planets. That's not a bad thing because that's happened in other sciences. Smoking and science used to be on different planets. People smoked in airports, so we didn't know about secondary smoke. So sometimes it's like the science is catching up with the reality. And so I'll be honest with you. In my 30-year career, most of it was not even that this was even an issue. In fact, I got caught up into the issues of, if anything, overweightness, pressure on the heart. And so if I said anything, it would be diet change, more exercise. But what I'm coming to realize with some of the training on family systems trauma work, no, it's not diet, nutrition. Big difference. I'll show you what I mean. So in the book, I write this quote that I think sets the stage. Despite advances in nutritional therapy, you could say despite advances in smoking years ago, over the past 30 years, research showing us there's almost no inclusion of nutrition when we talk mental health. And as a result of this, therapists blow past nutrition and they quickly go into, yep, let's look at psychotropic meds, which isn't bad because it has its place. I'm not anti-medication, by the way. I'm more like timing and other interventions. And the medicated brain, like I said earlier, is the first thing tried without trying the nutritional brain, or both and. Like I've worked with families where we do both at the same time. So you always want to have, with a new technique, a transition statement. One of the things in my book that took so long to write is because I was the person who got books out of graduate school that were just principles. And I was like, I'm front line. I got to have a script like an actor. I got to have the handouts. And it frustrated me because an actor would never get a movie without a script. So why shouldn't we have mental health workers have a script? So in my book, I have the actual scripts. So here's what I'll say to families. Like a brain, like a car, you need proper gasoline. So like imagine if you had a diesel car and it says right on the car, diesel gas only, but you're like, well, whatever. I'll just put any kind of gas in it. I'm just going to put unleaded because it's cheaper. And all of a sudden, the car might make it the first round, maybe the second round, but then eventually the car engine just blows out. And I said, it's the same way when we feed our brain a steady diet of processed sugar, bad carbs, or no water, not vitamins, literally starves to death. And I'll get this from parents right away. Like, look, Scott, we didn't go to Whole Foods. We don't have the money to go to these expensive, places to get fruits and vegetables. And I'll say, no problem. You start with just water. Are you drinking too much soda? And like, it can't be that easy. I'm like, the body is incredible with trauma and neuroplasticity. What do you got to lose as an experiment? That puts the realm into small changes lead to big changes. And I'll say, so think of it this way. Our brain needs the white gasoline to rewire the neurons. And I'm going to show you maybe a sample nutritional playbook. Obviously, I'm going to get a nutritionist involved as we go forward because it's outside my competency area. I'm here to jumpstart. But let's just say we put the proper gasoline in the tank. And then I pause and ask for questions. And it's always amazing because people are like, I never thought of it that way before. And when your client says that, you do the happy dance, like, whoa, they've had insight change. And you've got to do this because I would say there's 3 things that get people really, really touchy. They're touchy about substance abuses because it solves problems for them with stress or it medicates pain. They get really touchy around electronics, especially like adolescents. Like, don't take away my electronics. I'm going to go into shakes. And people are also really touchy about food, um, like diet, nutrition. So you got to go slow with this and you got to be like curious, take a one down position. And I'll say, have you ever thought about this way before? Because when I would bring up nutrition, sometimes it would be like a hammer. Like I'd say, you guys got to have this. Now I'm more like in the role of like curious, detective. And you know the old saying, it's not what you say, it's how you say it. So that's really important as we go on, is to kind of think that this is co-collaboration, because food is really touchy for people. So it's not what you say, it's how you say it. So along the same line, you want to do an assessment, a simple tool for them to reach out to say, I have a problem. In other words, people aren't going to look for a solution unless they know I've got an issue. So I'm going to say to them, can we look at your intake and brain growth around water, protein, energy, vitamins, minerals, and trace elements? And I'll say that when I give you this simple assessment, it's not judgy. In fact, I'll be honest with you, I'm working on this stuff too, especially with COVID. It was like, I say to my clients, I'm like, look, I was just eating candy. I was just surviving. But as we come out of COVID and summertime, this may be a good time to look at this. And I'll say to them, if this interests you, this is a book written for parents. It's called Parenting the Whole Child by Dr. Scott Shannon. And this assessment comes from Scott, or Dr. Shannon. He gave me permission to publish it in my book, and he gave me permission to give it to you. And he's one of the few psychiatrists in the world that advocates for the nutritional brain change. And when you read the case studies in here in this book, it'll blow your mind about the changes that happen quickly in kids when they just adjusted water. It's amazing. So I say to them that Dr. Shannon gets the credit for this. He's just allowing me to pass this on to you. And I hand this out. Now, if I have an older child there, I'll have them as part of this discussion, because what I found is that food is really touchy for kids. Like, they really, really like soda. They really, really like energy drinks. They really, really like to eat bad carbs. So they may not agree at the end of the day, and the parents still may have to make a decision that we're going to go forward this, but they can't say that they weren't part of the discussion. And that's really important. So I'll say to them, like, look, on a scale of 1 to 5, 1 being you're not even following these guidelines, and 5, you are almost 100% of the time, where are you in each of these 6 ingredients? So I'll say on a scale of 1 to 5, how hydrated are you? How hydrated is your child? I really focus on the child at first, because they're there to fix the child, not fix themselves. But inevitably, it just smoothly, without even you saying it, they'll talk about their own hydration, which is what you want, but you don't force it. Then, are they eating enough protein? Are they having enough good oils? Are they using, and then fresh fish? A lot of them will be like, man, I don't have the budget for fish. And we'll go into other things that you could do with vitamins, like fish oil, for example. You can buy at Walmart or wherever, it's cheap. And one might say, could you just try fish oil? And then vegetables. So then there's a scale when you add up the score of poor diet, moderate diet, good diet. And so I'm going to show you a case study here for you to think about, because we're going to dovetail this next week. So the question is, again, ask yourself, would self-assessment be key for your clients? And we can post this question as well on this recording. Why do you think self-assessment is key? Well, I'll give you mine, and then I'd like to hear yours. My first one is, I think we have to do psychoeducation or trauma-informed before we go to trauma responsive. look, sometimes we just skip over the psychoeducation. We're like, oh, here's a tool. But people have to answer the question, WIFM, what's in it for me? And so now I back up and say, I can't skip psychoeducation. I can't skip trauma informed. I can't go right to trauma responsive, because when I do it, I get burned every time. So one of the things that the self-assessment does is allows the client, whether it's a family, individual, or couple, to say, oh, I'm rating my diet, or I say, no, nutrition, okay? And let's see where you're at. And this gives them knowledge is empowering. So in this case, I'm going to show you, as we wrap up today, this is exactly what happened. Let's go to the case and we'll listen to the father and how he self-assesses the family as poor diet. And then next week, we'll talk about, now what? And now that we have a self-assessment and we know there's a problem, the family's or individual or couple is going to turn to you and say, okay, I got a problem. Now what? That's the segue. You can talk about a nutritionist. That's the segue. You can say, could I jumpstart you? So let's look at this. So you can kind of see how this works. So given that self-assessment, I'll call this client Lisa, confidentiality, and the family allowed me to show this, but I'm deifying any, identifying information. So Lisa, not a real name, is 13. And why this makes this so complex in trauma is there's multiple protective factors that are missing at the same time. And when you have more complex trauma, the brain is more, kind of damaged because there's more trauma. So the sexual abuse by the dad throws the wiring in the brain off huge. Then because of the abuse, she starts self-harming or cutting, suicidal threats. She's sexually acting out. And her sister is also, watching all this, and she's getting depressed and sad for her sister. And the parents are on the brink of divorce, and there's no village. Look, even one of these problems would be challenging. And the temptation is to do symptom chasing, storm chasing, where you've got a multi-symptomatic family. Which symptom do you go after first? The analogy would be weeds. But I believe that nutrition is a core Pilates type of thing, metaphorically, to get to the root. So when you look at the root, it helps with the fruit, so to speak. So here, this dad is presented with the self-assessment dietary guideline assessment. And look at how the assessment brings insight. Look at how he is able to identify, I didn't think about this before, but we have a poor diet. And then I offer as onboarding, would you like to move from education to application? So I'll just show like a minute of this to set up what happens next. Let's watch.
Remember when we talked about nutrition and I talked about, we did that thing about the dietary stuff, and I guess I want to ask you, is that something we want to take a stand on in the future in terms of nutrition, like water, protein, vegetables, and all that? Because I think you guys said that, what did you guys say the diet was? Do you think it was on a scale of 8 to 16? Poor diet, average diet, or great diet? What do you guys remember what you said when
I'd say
talked about it?
It's a poor diet.
Okay.
And that would be all of us included. We try and do more for the kids, the babies, like a lot of fruit and stuff like that. And I mean, when we do have meals, we do vegetables and, you know what I mean? We don't just eat all junk, but we snack a lot and eat at the wrong times of day and don't drink enough water.
So, I mean, do you want to take a stand on this piece right now or wait down the road on this one?
Okay, so perfect question. So what I've done there is I've said to the dad, self-assess. And so he says, I'm self-assessing for me and the family, poor diet. And then I say, okay, now that I've done trauma-informed or psychoeducation, do you want to go to the next step? And again, if I left that out, what a train wreck. If I just said, oh, Dad, you need nutrition, or Mom, you need nutrition, they'll be like, why? So now he's starting to think differently. And from that new insight, new narrative, comes new possibilities of change. So as we wrap up today, let me just kind of summarize, what, after you leave here today, kind of what next steps are and what did you gain today? So, how did this assessment help the father? I think his voice tone tells you he's curious. His response is, I don't know, which is honest, but from that, we can pivot to new possibilities of change and bring in the nutritionist. It really integrates nutrition into treatment in a very methodical, systematic way with the script. And so your walkaways today, takeaways, is you have a better sense of our role, which expands from just direct practitioner therapist to what's it like for us to be more intentional as kind of a social worker broker on steroids. I hope I made a good case for that today. I also hope I made a good case for our community that there is need to be trauma-informed and self-assessment around this issue, that we do need education before application. And so this is a great setup for next week, because as we go through this more in depth, the dietary guidelines, which is, really important to look at. Just I'll actually just copy this in the the link here, but this will be in our recording. So please download this, because it will take you to a sample nutritional trauma playbook. Now, don't get caught in the it looks very much kind of behavioral contract. Yes and no. It's done in a very unique way, because at some point, people have to fake it till they make it. In other words, parents get caught up in, well, just try this. It'll work. And sometimes they have to say, I'm just asking for one change breakfast as an experiment. And so you'll get to see how we jumpstart families so that we can move them more and more to a nutritionist as needed. So hopefully see you next week. And if you can, please tell your colleagues and come to the big one on July 21st. So this is me, Scott, Family Trauma. And I just wanted to say thank you. And so post your questions on the recording, and I'll come back and answer some of those. So thank you very much, community. I enjoy just meeting with you for Family Trauma Solutions on Thursday. So have a great day, everybody. Bye now.